income options for people who are unable to work, and about return to work. And that's actually what we're going to be talking about today. We sort of have two topics, although they are related. The first topic is on financial matters, particularly in relation to, benefits and disability and the ins and outs of various programs. And the second part that we hope to get to as well has to do with returning to work once you've been off work with a cancer diagnosis. So without further ado, what I'll do is I'll let Irene take it away. And again, I want to encourage you to enter your questions now into the chat when you, or rather enter them as you have them. But if not, we will have opportunities towards the end of the presentation to discuss them. All right.
Thank you, Jeff, and thank you so much for having me come to speak on this topic. So we have two topics today, as Jeff mentioned. We're going to talk about financial matters when you have a cancer diagnosis, and then returning to work post-treatment. So I'm going to start off with a focus on the financial matters. And so if you are dealing with financial hardship and difficulties because of your cancer diagnosis, you are not alone. There's a fairly new term in oncology now, financial toxicity, and it really, really recognizes that there could be a personal financial burden that is attributable to a patient's cancer diagnosis, their medical care, and that impact flows over to not just the patient, but to their families and caregivers as well. And there have been a number of studies that take a look at the financial impact of cancer, and two very recent Canadian studies that looked at patients in a number of Canadian cancer centers illustrated that there was definitely a financial impact. So in the first study, as you'll see, 40% of the people that they studied indicated that they experienced financial struggles during their treatment, and along with the financial struggles, understandably, came emotional distress. In the second study as well, 33% of the patients responding, reported that they had high levels of financial burden, and the severity of the burden seems to be higher for those with lower household incomes. So what causes that financial hardship? Well, I think everybody can relate to this list. So the main thing is going to be lost income, and that's for the patient and the caregiver. I think in that category, we also have to think about, the additional financial impact of COVID-19. There was more job loss over the past 2.5 years. And then along with that, the lost income, we have all of those increased expenses, drug costs that might not be covered by a plan. We know what parking at a hospital costs, travel to and from the hospital, gas costs, especially now, and then other things, the medical supplies, alternative treatments, childcare, housekeeping. I think the list could go on and on. And, we are very lucky to have socialized medicine and social income support programs. But, as we're going to see with examples of what these programs pay, they may simply not be enough to address the financial burden of a cancer diagnosis. So where some people feel, the government's going to help me out, or I have a long-term disability policy at work, or I'll just tap into my savings, it ends up being a bigger burden, I think, than anticipated. And what sometimes happens, and this is an older study, but I think still very relevant, is when people feel that financial burden, they end up having to access their savings, often retirement savings. They might have to refinance their house or take on other forms of debt. Some people report having to go back to work before they're fully recovered. Some people have to work during treatment. But in this particular study, again, it was reported that with that financial burden comes a lot of stress and anxiety and difficulty sleeping. And so it's something that is really, really important and needs to be addressed. So how do we address it? So it's hard in a short presentation to provide you with an overview of all of the financial programs that are available. But I thought that I would at least show you the framework that I use when I'm helping patients with their financial concerns, and through that give you a brief introduction to some of the financial assistance programs that are available in Ontario. If you are on the presentation or listening to the presentation and you're outside of Ontario, the federal programs will still apply to you. And when I talk about the Ontario Disability Support Program, for example, there will be a parallel program in your province as well. So let's start off with the income replacement programs. And these are the programs that people access if they have to stop working for treatment. So I like to put them in 4 categories. So starting at the top left, the financially tested programs. So those are the programs, but that before they even look at the level of your disability, they will want to look at your financial situation. On the right, we have our contribution-based programs. So those are going to be the programs that when you look at your pay stub, you're contributing to those programs. Or if you're self-employed, you're contributing through your tax return. Lower left, we have our workplace programs. So things that you'll find in your benefits booklet at work. And then on the bottom right, we have personal resources. So those are things that are, again, personal to you. So specifically, and we'll go into a little bit of detail with each of these programs. On the financially tested, we have Ontario Works and Ontario Disability Support Program. So again, if you're not in Ontario, there will be a similar social assistance program as well as a disability program. So I encourage you to look into those. On the right are the contribution-based programs. So employment insurance sickness benefits we'll look at, and Canada Pension Plan disability benefits. So those are federal programs and are available across Canada. With Canada Pension Plan disability benefits, though, if you're in Quebec, you're going to look at the Quebec Pension Plan disability benefits. And then the workplace programs. So again, you're going to look in your benefits booklet, and you may have short-term and or long-term disability. And then lastly, your personal resources. So again, these are personal assets that you might have, insurance that you might have. So again, we'll go into now all of these in detail. So I'm going to start on the top right with the contribution-based programs. And I like to start with this one because employment insurance sickness benefits is typically the first program that you start with if you don't have short-term disability through work. What you need to be eligible for employment insurance sickness benefits is you have to have worked 420 hours in the past year. That amount of hours was lowered due to COVID and is going back up to 600 in September of 2022. And you have to be medically unable to work. There's no medical adjudication done. It's a very simple medical certificate that just has to disclose how long the patient will be unable to work. If you're eligible for employment insurance sickness benefits, they are available for up to 15 weeks. And what do they pay? They pay 55% of average weekly earnings, but they max out at $638 per week. EI is taxable, so they're going to take a little bit off at source. You do an online application, and if all the documents are in check, you should receive your payment in about a month. And then you don't receive a payment for the first week that you're off of work. There's a 1-week waiting period with EI sickness. So again, this is typically, if you don't have short-term disability, this is the first program that you're going to access if you're employed and unable to work during treatment. So sticking with the top right in our contribution-based programs, Canada Pension Plan disability benefits. So everybody knows CPP for the benefits we hopefully are going to get when we turn 65. Well, there is a completely separate program called Canada Pension Plan disability benefits. And one of the questions that people ask me all the time is, if I access Canada Pension Plan disability benefits, will it impact what I get at age 65? 65? And the answer is no. There is no negative impact. If you get disability benefits, you will still get the same amount at age 65. So it's a separate pool of money that's available to people with a disability. So 2 prongs of eligibility for CPP disability. The first one is that you've contributed to CPP in 4 of the last 6 years. So again, if you're an employee, you've been contributing on through your pay stub. And if you're self-employed and earn a certain amount of income, you will also be contributing to CPP through your tax return. If you pass the first test, you've made the requisite contributions. You next have to file an application and a medical report, and Service Canada will determine if you meet their definition of disability. And their definition of disability has 2 important prongs. Number 1, it has to be a severe disability. And that means you're not capable of doing any type of work, including your previous job. And it also has to be prolonged. And there's no time frame mentioned in the provisions, but ballpark, they're looking for at least a year. They're looking for something really of indefinite duration, but if it's under a year, it will be difficult to get CPP disability, but still always worth trying. So what does CPP disability pay? Well, the amount you get is based on how much and for how long you've contributed. So the average is around $1,000 a month. The maximum is $1,457.45. If you have children under 18 or children 19 to 24 who are in full-time school, you get an extra $264.53 per month. Okay, so that is CPP disability. And so often, if you don't have workplace benefits, your flow of income replacement will start with EI sickness. And then if all checks out and you get approved for CPP disability, it would start when your EI ends. So EI sickness to CPP disability. So now we're going to move on to the top left category, and those are our financially tested programs. And I'm going to start with Ontario Works, which was previously called Welfare, and that's our emergency social assistance program. So it's financially tested. So the very first thing that they are going to look at when you apply is first of all, your assets. So your liquid assets have to be below a certain level. And as well, your household income has to be below what Ontario Works would pay you. And then they determine which type of caseload you be on. So are you somebody who's just on temporarily while you're looking for a job, or are you disabled and you're going to move on to the Ontario Disability Support Program? But the main thing for this stage, they are looking for assets and income and making sure that you pass those tests. If you are approved for Ontario Works, these are just some of the examples of the basic payments, which are comprised of a basic needs amount and then a shelter amount. So a single person would get $733 a month, a couple $1136 a month, and a couple with 1 child $1191. There are additional benefits available when you're on Ontario Works. The great thing is you get a drug card, and that covers prescription drugs that are on Ontario's formulary. There's some vision care for dependent children. Eye exams are covered for those ages 20 to 64. There's a special diet allowance, and I always, put stars on this one because this is a good way to get additional money from the Ontario Works program. So for example, if you have, a dairy allergy or diabetes or high blood pressure or high cholesterol, if your doctor fills out the special diet application form, you can get some additional funds by virtue of that program. And similarly, I tick off travel and transportation because if you're traveling frequently to the hospital, Ontario Works may provide you with some assistance with your travel costs. And, again, other things like diabetic and surgical supplies, repairs and batteries if you're using mobility devices. So again, a few other things that you can use to supplement what you're getting from Ontario Works. So the Ontario Disability Support Program is sort of the companion program to Ontario Works, and it's for people who have a disability. I view Ontario Works more as an emergency. It's a temporary program. Ontario Disability is for longer term disabilities. And just like ODS, just like Ontario Works, there are financial requirements. So again, you have to have assets below a certain level and income below a certain level. And those levels are, much higher than Ontario Works. And then if you pass the financial eligibility requirements, then they're going to assess your level of disability again through a form that the patient fills out and the medical report that the doctor fills out. And they're looking, as you can see on the screen, for a substantial physical or mental impairment that's expected to last greater than a year and has an impact on daily living. And for daily living, they're looking at your ability to attend to your personal care, to function in the community, and to work as well. If you are approved for ODSP, you'll see that it pays more than Ontario Works. So just under $1,200 for somebody single, a couple $1,750, and a couple with one child $1,815. And as with Ontario Works, there are ways to sort of supplement your benefits. You get a drug card. There are some basic dental benefits, vision care benefits available. Once again, there's a special diet allowance available, a good way to increase what you're getting from ODSP, and similarly, a medical transportation allowance as well. And then we'll move into the lower left quadrant, and those are your workplace programs, which are short-term and long-term disability. So with short-term and long-term, they are governed by the contract that's negotiated between the employer and the insurance company. And I put unique contract because although there are a lot of similarities between plans, there are definitely differences. So I talk very, very generally about these. You really do need to read your benefits booklet to check about your particular policies. But short-term disability can really, really range in terms of how much it pays. So I've seen plans anywhere from 60 to 100% of salary, and also the length. I've seen ones that are as short as 6 weeks and as long as a year. And with short-term disability, it's most often paid by the employer. So you end up getting something that looks very similar to a paycheck, or sometimes paid by an insurance company. And then your workplace may also have long-term disability. So that would be a group long-term disability policy, although you may have purchased a private policy. Those are available as well. And with long-term disability, there's an elimination or waiting period. So you have to wait a certain length of time before you would be eligible for long-term disability. And that's typically the length of short-term disability or the length of employment insurance sickness benefits. And long-term disability typically pays a percentage of salary. Some of them are flat rates. We see a lot at about 67% of your salary. Some have formulas, so they're all different. But, the general one we see is somewhere around 60, 67%. And your long-term disability benefits can be taxable or tax-free. It just depends who pays the premiums for them. And then lastly, are your personal resources. So those are things that are specific to you. And that's going to be, everything from your savings, your retirement savings, property that you may have. So again, these are things that as a last resort, you may have to tap into, with getting the appropriate financial advice if your income replacement is just not going to be enough to help you while you're going through treatment. treatment. You should check your workplace policy. More of them lately are having small critical illness insurance benefits. And you should also check on your mortgage, lines of credit, and credit cards to see if maybe you've been paying into disability insurance on those. Sometimes when they offer you the mortgage, they also offer disability insurance, and you just pay an extra amount per month, and you're covered if you have a disability. And some life insurance policies, in case of emergency, do sometimes have living benefits. So something you may want to take a look at, again, as a last resort. So those are basically the income replacement programs. So those are the sources that are going to replace the income that you were receiving through your job or through your self-employment. But there are a couple of other areas that it's important to also make sure you're accessing everything that's available. And the first area I like to look at are your treatment related expenses. So what's out there? So number one important thing is drug coverage. And what I'll mention is the cancer centers now have what they call drug access navigators or medical reimbursement specialists, and they know the ins and outs of all avenues for drug coverage. So I encourage you, to sit down with one of the drug access navigators if you're having some issues with covering your drug costs. But basically, just to give you sort of the overview, in terms of sources of drug coverage, we have our Ontario Drug Benefit Program, which I'll show you the different components. There are other programs offered by the Ontario government for prescription drugs. So there might be funding through Cancer Care Ontario. The Ministry of Health has an exceptional access program. Again, another source might be your group insurance that you have available through work, or a private policy if you purchased extended health benefits privately. And there's also, with some drugs, compassionate access programs that are offered by the manufacturer of the drug. So in terms of the specific Ontario drug benefit programs, the sort of main, what I call public drug program, is our Trillium drug program. And that is available to anybody in Ontario with a health card. And basically, it's a program that will be a benefit to you if your drug costs are high relative to your income. What Trillium has you do is spend a certain amount, a certain proportion of your income, they call it a deductible. You spend out of pocket up till you hit your deductible, and then the government kicks in the rest. If you are receiving nursing care through the LHIN, it's now called Home and Community Care Support Services, you may be able to get a drug card through that source. If you're on Ontario Works or ODSP, there's a drug card available to you. There's the Seniors Ontario Drug Benefit Program, and OHIP Plus, which is for those that are 24 years old and under. So some other sort of helpful resources in terms of medical expenses. The Assistive Devices Program is Ontario's program that helps with mobility aids, diabetic supplies, home oxygen therapy, visual aids, compression garments, ostomy supplies, that type of thing. And again, there will be parallel programs in other provinces. So that's something to look at. So the government will typically cover a portion of the cost of those types of items. Accessible parking permits are a handy thing to have because yes, they allow you to park in places that make where you're going much more accessible, but in some areas you may not have to put money in a meter. So again, check the rules of the city you're in to see if that's a possibility. Home and Community Care Support Services, again, formerly called the LHIN or CCAC, they have home care services available for people that need some help with personal care. So they don't do things like housekeeping, but they will come in and help with, showering, that type of thing, getting dressed for those that meet their requirements. And those are, services that you can self-refer offer or refer through the hospital, and they'll do an intake to see if you're eligible. You can always pick up the phone and call the Canadian Cancer Society. They have information specialists that know, a number of different resources in all different categories in terms of medical expenses, and they know it by sort of geographical location. So that's a really good information source. If you need dental work done, again, see if your hospital has a dental clinic, and otherwise there may be low-cost dental clinics available in your city. And check as well if you're in a low-income situation where you're not on Ontario Works or ODSP and you have a one-time expensive health-related need, you can talk to the discretionary funding department. It's called different things in different municipalities, and they may be willing to help with that one-time need, again, if you can demonstrate that your income and assets can't cover it. In Toronto, it's called the Hardship Fund, but in other cities, it's usually some type of discretionary funding, and you just find it on your city's website. And then, we know that transportation costs are a tough one. So check if there are any local transportation services. So sometimes charitable organizations will offer subsidized rides. The Red Cross has a system in some cities where they offer a per kilometer rate. The Canadian Cancer Society has their Wheels of Hope program, which provides volunteer drivers. You pay a one-time $100 registration fee, and you sign up for these volunteer drives. Parking passes, again, still expensive, but it cuts the cost if you can buy a number of, parking opportunities in one pass, as opposed to paying each time that you go. I don't have it on the slide, but in terms of transportation, if you are traveling over 40 kilometers one way to treatment, you want to look into the medical expense tax credit, because then you may be able to claim a per kilometer rate on your tax return. And then just shifting gears a little bit, you may want to look into local charities. So first of all, check with your hospital. Some of the hospital foundations actually have a fund where they might be able to help with certain types of medical costs. The Shine Through the Rain Foundation helps with parking costs at the hospital, and Uber and Lyft and taxi if you're taking those to appointments. And check again local organizations, your local Salvation Army, March of Dimes has an assistive devices program. So, Google what it is you're looking for, and something may come up. And then looking at, outside of the medical realm, things that, you may be having difficulty because you're dealing with lower income and higher expenses, possible resources to help you with household expenses. So if you are on Ontario Works or Ontario Disability, your municipality will have some sort of housing stabilization fund where they would help with rental arrears and also help with utility arrears. Look into subsidized housing if rent is an issue, although I know in Toronto, and I'm sure it's the same in your area, that the wait lists are a little bit crazy right now, and have been for a number of years. Many cities have a rent bank, so it's sort of a one-time interest-free loan if you need some help with rent. For utility arrears, check out the Low Income Energy Assistance Program, or LEAP. They help you with your electricity and gas bills. You can apply if your income is below a certain level to the Ontario Electricity Support Program to get a reduction in your bill. And then also check in your municipality if there are any water bill relief programs. So there's nothing that's going to sort of eliminate the water bill, but there may be programs that will, maybe stop increases, things like that. And then, you know, if you're having trouble, especially with the cost of groceries right now, you know, look into food banks. A lot of them are really, really good and have, you know, good provisions and can really, really help with food costs. Like water bill, look into property tax relief programs. Again, with subsidized housing, you may also want to look for local, what they call housing help centers. And those are organizations that help not just with subsidized housing, but helping with lower market rent units as well. And then if you're struggling with debt or having trouble budgeting, credit counselors are a really, really good resource. So these are different from bankruptcy trustees. Credit counseling agencies are typically not-for-profit agencies whose goal is to not get you down the path to bankruptcy, to help you manage your debt, consolidate your debt, budget, that type of thing. So a really, really good resource. And then, you know, 211, and, you know, another good online and telephone resource. You just pick up and call, and they know about all different community resources in your area and may be able to help you with a particular concern that you have. If it's government related, 311 will also help. And again, look for local community agencies. Again, they may offer everything from, you know, equipment loans, you know, drives to appointments, friendly visiting, things like that. And then if you're having issues, you know, with ODSP, or you've been turned down for CPP disability, the community legal clinics that are offered by Legal Aid are free of charge if you meet their financial eligibility requirements, and they can be very, very helpful if you're dealing with a government program. And then again, always take a look and see what charities might be out there. Again, I mentioned Shine Through the Rain Foundation earlier. They help with overdue rent and utility bills. And again, you know, check out local ones, your local Salvation Army. Ceridian Cares is a charitable organization that helps with a bunch of different needs. And so the bottom line is, you know, figuring out how all of the programs fit together is not easy. You know, I've just given you a ton of information about a number of different programs. And the problem is with the government and workplace programs, they don't always sort of fit together easily, and it can be difficult to navigate. You know, so I encourage you, reach out to your hospital social worker, or please feel free to reach out to the Money Matters program at Wellspring. So that's the opportunity to have a one-on-one appointment with a case manager by phone or by Zoom, and you know, talk about your financial issues, which programs to access, help with paperwork. We do ongoing case management. So again, don't hesitate to reach out. You can just send an email to moneymatters@wellspring.ca. I know we want to have time for questions, so I can just very, very quickly go through, you know, a little bit about returning to work after cancer treatment. As it turns out, about 62% of cancer patients return to work after treatment. But, you know, the difficult part for many patients is figuring out when the best time to return is. And a lot of people will go through a little bit of debate in their mind. You know, making that decision if and when to return is difficult. And you may have concerns about returning to work. You know, am I going to be able to do my job? I'm still dealing with brain fog, or I'm still dealing with a lot of fatigue. Or you might be worried about going back to a stressful work environment, or answering loads of questions from your coworkers. You might have concerns about, you know, keeping self-care at the top of your to-do list. Or you may, you know, feel that work has a different role for you right now, given the journey that you've been on. But you may also see the flip side, that there may be some things about returning to work that you may be looking forward to. A lot of people like, the social aspect of work. The financial security is a big one. People miss being challenged, want a little bit of distraction. And some people crave that, structure and schedule and routine that goes with working. So how do you decide if you're ready? So I'll give you a quick little way to do it. Start by making a list of your job requirements. So all of your duties and tasks. Make sure you write down how long your workday is, and sort of try and divide up the tasks into physical tasks, communication tasks, and thinking or cognitive tasks. And then look at that list and say to yourself, okay, if I had to go back to work today, how would I perform relative to what my job is required of me? Would I be able to carry out all the duties, maybe some of the duties? Do you think I'd make it through a full shift? Could I manage the commute? Would I have more trouble perhaps with physical tasks or communication tasks or thinking tasks? So again, just think about where you are relative to what your job requires of you. And then there are two ways to look at it. There's, often a gap between what your job requires of you and your readiness to, meet those work demands. And in some cases, you can try and address the gap by what I call pumping up the personal. So getting yourself ready in terms of your personal resources. And so that involves goal setting. Setting personal goals. So maybe you want to increase your energy. Maybe you want to work on your brain fog. So maybe you're going to set some goals to get a more regular sleep schedule, add in more self-care, to prepare for dealing with coworkers and clients, maybe start engaging in more social activities. For your brain fog, maybe you want to come up with some new memory aids that can help you, or take a program to help you with brain fog. But you also have to focus on those work-related goals. And I always call this living the life of work before you actually return to work. So what you're trying to come up with are activities that simulate what you do at work. So that could really just be getting up as early as you would for a work day, and maybe even getting your work clothing on. Try doing the commute, try doing some technical reading, and maybe try out some new time management or organizational tools. So again, you're setting goals to help those personal resources align with what your job requires of you. But, you may realize that in some areas, you're just not quite where you need to be. You'll get there. So maybe you have to bring the workplace demands a little bit down to meet where you are in terms of your personal resources. So that involves asking for accommodations from your employer. So that could be modifying the duties, maybe having more flexible work hours. Much more acceptable now is being able to work from home. If there are some physical issues, would some type of ergonomic office equipment help you? Support, would a work buddy help, or division of responsibilities with the person who was doing your job while you were off? And then the other very helpful thing is what we call a graduated return to work. And I'm just going to skip ahead to that. So a graduated return to work involves a few components. So the first main thing is time. So it's where you are going to gradually increase the number of days and the amount of hours that you're working over a period of, let's say, 6 to 8 weeks. So that really helps you get accustomed to being back at work, helps you, slowly ramp up your energy and have a little bit of downtime on those days you're not working. And then you can gradually build up the functions of your work. So the tasks and responsibilities. So maybe the first couple of weeks, you're just reorienting yourself to the job. You're doing some training, you're shadowing somebody. And then gradually you can add on the additional tasks and responsibilities till you get back to your full job. And then other things too that are good to build in, just to make sure everyone's on the same page, maybe weekly meetings with your supervisor and team, just to check in on how your return to work is going. And maybe, you know, partway through a reassessment by your doctor, just to make sure that, you know, you're doing okay with the return to work. And if you're interested, we do at Wellspring have an online education and support group that focuses exactly on what I talked about, assessing your readiness, getting ready for a return to work. It's a 6-week program, so you know, don't hesitate to sign up if you think that's something that would be of interest. So if there are any questions, I would be happy to take them.